The company DaVita has a new dialysis center ready to open on Wanamaker Road in Topeka, but nearly a year after applying for its required certification inspection, you might notice all the chairs sit empty, the monitors and machines silent. When we started asking why, we learned it likely won't open for at least another year, which has some dialysis patients telling us they're frustrated when they're living with the disease with few options.
That takes a lot of time.
For 7 years, dialysis has kept Renee Jacobson alive.
It's 3 times a week and 4 hours in the unit.
A hereditary disease attacked her kidneys. So she drives from her home in southwest Shawnee County to DaVita's dialysis center in central Topeka, where machines take over the job of removing the waste and excess water from her blood.
I drive almost 25 minutes just to get there.
When she heard DaVita was opening a new center at Southwest 37th and Wanamaker last summer, Renee was excited to cut her drive time in half.
It's important for me to get home and get back and get in my bed because I don't feel well after that, and most dialysis patients don't.
But Renee is still waiting for it to happen. The new building, 24 dialysis stations, all sitting empty.
We were really hoping that within about 3 months of asking for certification that it would open.
DaVita applied for its initial inspection by the Kansas Department of Health and Environment last October. In January, the company submitted medical necessity paperwork showing the facility should be given higher priority, but the request was denied. And on August 19th, KDHE notified DaVita that the inspection on the Wanamaker site, along with one in Kansas City and a new clinic in Emporia that applied 2 years ago, will not happen until at least September of 2017. Without certification, Medicare and most insurance will not cover patients getting their dialysis there.
We have over 40 patients that are interested in dialyzing at this facility. This facility is here and there's so many benefits to them.
Well, we certainly understand the concern that they have.
Jim Perkins, director of the state's health facilities program, says he currently has 8 inspectors, but only 3 are trained to inspect dialysis centers. Federal rules say no surveys for new centers can be done until the inspectors clear up all cases involving complaints or safety issues. And they oversee not just dialysis facilities, but other types of health clinics as well. That caseload topped 300 inspections last year, plus complaints leading to 38 on-site investigations.
We always send at least 2, sometimes 3, to a facility that needs to be surveyed. So it stretches them out pretty thin.
But even stretched thin, the 2-year waits DaVita is facing are outside the norm. KDHE says of 15 new dialysis centers opening since 2008, the average wait from application to initial survey was just over 7 months. What changed? Perkins cites turnover plus the extra training to do inspections at dialysis facilities.
Of the 8 that we have now, 5 of them have come on since the first of the year.
Perkins says KDHE is working to increase staff levels, and Heinrichsen says for DaVita, the solution is important to meeting future needs. This CDC graphic shows the prevalence of end-stage renal disease in 1999. No states colored at the highest ratio. By 2013, you can see how that changed. Heinrichsen says DaVita has 180 patients at its current Topeka location. They fit them all in, but it's not easy.
I would say we are getting close to max capacity. We are able to add in spots for new patients, leaving little room for patients to move around and change times.
And patients like Renee say a little bit of convenience would be nice when living with a disease that's anything but.
Nobody wants to be on dialysis, but if they can cut their time by getting here and then getting back home, that would be wonderful.
The state health department counts 3,200 people in Kansas on dialysis. Jim Perkins told me one more person will be training early next year to inspect dialysis centers. But as for speeding up the process, he says it is unlikely as long as federal rules require them to first deal with those complaints and safety issues. We'll keep you posted on the situation for Renee and other patients as it continues to unfold. It's interesting. There are federal rules that kind of dictate what they can do, and they are, Jim Perkins said, actually recruiting more staff. DaVita keeps waiting.
The regulations as opposed to the expediency of taking care of all these people. So, Melissa, thanks.